Welcome to this third section on insulin and diabetes. Here we look at the comorbidities, complication and role of lifestyle correction in insulin management and diabetes. To begin with, the first question is, when type 2 diabetes is diagnosed, metabolic disease is already there. What is your opinion on that?
See, insulin is one of the most important hormone for the metabolism. That is not only for the carbohydrate or the glucose, for the fat and also protein metabolism. So the problem with diabetes is either low insulin in type 1 diabetes or insulin resistant. It is high or high insulin in type 2 diabetes. So the metabolic syndrome, that is we commonly call this that is obesity or excess fat in the body. Then first maybe diabetes or the first hypertension will come, or the first diabetes will be coming, and dyslipidemia. Along with that dyslipidemia also, that is high triglyceride. Actually it is not the cholesterol that is more important, it's the triglyceride will be increased. Definitely along with the triglyceride, total fat is increasing. Fat is not able to dissolve in the blood. So to make it dissolved, it is formed into lipoproteins actually. So the lipoprotein it needs cholesterol also. So because of the changes in the metabolism, this lipids, that is lipid profile, also will be increasing. The triglyceride and cholesterol will be increased in this. So it's already the insulin is the problem actually. Insulin, either if it is low or it is high, both is a problem. And in the type 2 diabetes, that is the 90 to 95% of the patients who are diabetic is type 2 diabetes. Here the problem is because of the high insulin and high triglyceride in the body, and again the glucose also is high, and this high insulin is the culprit which is producing this hypertension. If you can notice that if the person is started with the diabetes and after starting medication, they will get the hypertension also, because this most of the medications, insulin and the other oral medications, actually increasing the level of insulin in the body. They are pushing the pancreas to make more and more insulin. So the hyperinsulinemia, it is not only the glucose is increased, glucose may be reducing, but the insulin will be increasing, and this insulin will create problem for it will affect the kidney. Kidney is one of the major part which is controlling the blood pressure. It is affecting the kidney, and sodium retention will be there, and the pressure will be increasing. When the diabetes is increasing, the pressure also will start increasing, and the dyslipidemia or the triglyceride will start increasing, and then along with that this fatty liver, coronary artery block, heart attack, stroke, and it is like that. The progression will be like that.
Actually, you are just mentioning about these high insulin levels. Is high insulin levels also considered a disease condition in diabetic patients?
Yes, high insulin level, actually we the medical people was not knowing about the high hyperinsulinemia, or there was no method to check this hyperinsulinemia and all. Only recently we got the facility. And because the treatment of the diabetes is established in many years ago, but the insulin is there for the last 100 years, and the diabetic medications is there in the last at least for the 75 years, and the number of medications is adding, number of type of insulin is adding, and so many medications. We are actually focused on the medications actually. And then we started for the surgeries also, the bariatric surgery, pancreas transplant, neonatal transplant, so many are coming. But we are not focusing on what is the real mechanism that was not available in the early stage. That is why it is fixed in that. But because it is working in this in a pattern, and the change is not happening, because with the modern knowledge, the change in the protocol for the diabetic, especially for the type 2 diabetes, it is not happening. That is the problem.
Normally these diabetic patients, they often actually have a problem of immunity, because they seem to catch infections more, and generally organ issues and damage and everything happens. At the same time, this high insulin levels, how does that affect immunity?
See, diabetes people have two problems, especially type 2 diabetes people have two problems. One is hyperglycemia, that is high glucose level. Next is hyperinsulinemia. That is the current treatment methods like insulin and oral hypoglycemic agents. It increases the insulin level further high. So when the insulin level is increased, the immune system functioning will be affected. The phagocytosis, that is actually the this our defense cells, that white blood cells, is actually removing all the this damaged cells and the cancer cells or the bacteria, etc. They catch and kill them or digest it. That is actually it's a continuous process. When the insulin level is high, this will not take place. So that is the importance of this fasting, that for 12 to 15 hours fasting and such things we often talk, that is good for the body and all. That is the reason for that. When you are not taking food, the glucose level will go down and the insulin level also will come down. In that stage, the immune system will function properly. So, if the immune system is phagocytosis is not taking place, the bacteria will survive there. The bacteria or virus affected cells also has to be removed. That will not take place. That cancer cells, there will be so many damaged cells will be coming up because of the nutritional deficiency toxins. So many cells will be getting damaged. They have to be removed, and those things will not happen. When the insulin level is high, that is the most dangerous thing. And also, even the sugar control is not there, then what will happen? This sugar is a very good medium for the growth of all these bacteria, virus and everything. So it will flourish in your body. That is the reason for this infections. And in diabetic patient, first is actually what is happening. This blood glucose and the insulin is damaging the blood cells. And diabetic nephropathy, which is very thin blood vessels are there in the kidney and in the retinopathy. They are actually getting damaged. And even this hyperinsulinemia, what is actually done for the retinopathy? We are injecting this during a laser surgery and all. What is it actually? Laser surgery, you are preventing the blood vessels to grow into the macula, the most sensitive area of the vision area, macula, the center of the vision is macula. If the blood vessels grow into the macula, your vision will be gone. So what is in the retinopathy, what is the ophthalmologist doing to the retina? They are that is lasering that blood vessels to prevent it is growing into this area, macula area. Actually there is not constructive surgery, it is a destructive surgery and preventing the blood vessels to grow. Why this blood vessel is growing? When the insulin is promoting the growth, insulin is a growth factor. So this insulin is promoting these blood vessels because they are damaged. They are not that retinal cells is not deprived of proper nutrition because of the blood vessels are damaged. So our body is trying to give them blood. If the blood vessel is drawn to that area, your vision will be gone. So the ophthalmologist to laser this thing, and also this injections, which also is actually. It is preventing this injections which is given for the retinopathy is actually some insulin like growth factor. It is actually blocking these blood vessels to grow. That is the only purpose it is. It is the real action is that. So if you are able to control the blood sugar and the insulin level, then the diabetes, this damage to the retina or even the very fine nerve, blood vessels are there in the nerves. That is actually getting, because especially the glove and stock anesthesia, this neuropathy. And so you are getting diabetic patients is getting reducing the sensation, pain sensation, or they are getting burning sensation. That is because of the damage to the nerves, which is happening because of the blood vessel damage. The fine blood vessels are damaged. So if you are able to control the blood sugar and the insulin level, this problem will not occur. So the simplest way of doing is reducing the carbohydrate intake and increasing the exercise to burn out the excess fat, which is actually creating the insulin resistance. So instead of, that is the scientific way of managing the type 2 diabetes. But instead of that, what we are doing, we are trying to increase the giving insulin injections and in increasing the level of the insulin further. So that is established for the last 50 years in the medical science. So it is very difficult to come out of that. So only with the understanding of the patients, because the doctors are focusing on the protocols. If a patient is coming and to a doctor, and if the doctor is saying that your insulin is bad and the tablet is bad, you should not take. But if the patient is getting a complication, the doctor will be sued, because the standard protocol is to give the insulin. And these are medicines, first line of medication, second line of medication, third line of medication. So doctors are forced to, even if the doctor is understanding that it is harmful for you, if the doctor want to practice, you have to follow the protocol. Otherwise, if a diabetologist or if they are, otherwise they should tell the patient that I am giving only this lifestyle correction. I don't do that. If you are, that is what I am doing is clinically supported lifestyle correction. Those who are wanting to avoid this medication, insulin or the diabetic medicine or the surgical procedures like bypass or angiography or stent insertion, those who are coming and very clear. If you are willing for the lifestyle correction with the clinical monitoring, we'll do that. We'll check that whether your sugar is getting controlled. And if you are not able to follow the other things, we can't help you. If you are not able to follow the lifestyle correction, control your food and take the proper nutritional food and do the exercise, then we cannot help you. There are people who ask also, Doctor, I don't want to do any food control, and I am very lazy about doing the exercise. Then you are not fit for this clinically supported lifestyle correction also. If you have willingness for that only, it will be effective. And that is the method. That is the 100% scientific and natural method of correcting is the lifestyle correction for the type 2 diabetes patients.
Actually, when you are talking of insulin, what happens is normally those who need to take insulin commonly, they also have hypertension. So how does this insulin impact hypertension, because they usually come together?
Insulin will increase the hypertension. If you are adding medication, if a person who is diabetic for 10 years and after some time or the last 1 year they are diagnosed with the diabetes and they started diabetic medicine also, definitely their hypertension medicine also has to be increased. And even with the hypertension medicine also, you will not be eating a very good hypertension control. And even with the medication and insulin, your insulin level also, you will not be getting any very good sugar control also. And many of the patients who are taking insulin, blood pressure, medicine, but your HbA1c will be maybe around 10, 12. Even I had seen patients who was on 14 and 15 also. But if the good control means around 8, that is the public concept of good control is around 8. But for the clinically supported lifestyle, I consider it is if you are around 5.5, the HbA1c level around 5.5 is a good control. And if you are, then it is you are out of the diabetes. That is what we are trying to achieve, and that is very effectively possible also. And if it is a reasonable control, means it should be around 6, not more than 6.4. Now, if it is more than 6.4, it is not controlled as far as we are concerned with the clinically supported lifestyle correction, and that should achieve without any medication. Even though if it's a type 1 diabetic patient, then the problem is type 1 diabetes patient, when they're taking insulin uncontrolled method without lifestyle monitoring, lifestyle correction, they will get the insulin resistance also. That is type 2 diabetes and type 1 diabetes. So that is because of the excess fat accumulating. That is possible especially with this insulin pump. Insulin pump take plenty of carbohydrate and fat, then pump insulin also, then definitely the person will get more fat and the insulin resistant insulin will not work. That is in the type 1 diabetes that also happen. And along with the insulin deficiency, insulin resistance because of the injudicious use of insulin. It is happening in the type 1 diabetes also. And using insulin and this sort of insulin increasing medication for controlling blood sugar is actually the type 2 diabetes is also unscientific.
Actually, when you are talking about diabetic patients, there is a large number of them who have rheumatoid arthritis also. And we find that this rheumatoid arthritis and insulin intake actually act in some ways which are not positive. What should patients understand?
See, diabetic patient, their immune system is derailed because of the lack of phagocytosis and things. So when the immune system is derailed, it is easy for them to get autoimmune disease and allergic disorders. And it is very common that to this sort of patients get thyroid hypothyroidism. It is very common in our part of the country. It is very common. Diabetic patient may initially may not be having, but after some time they get hypothyroidism or this rheumatoid arthritis or osteoarthritis. Either of the arthritis, because they'll be having excess weight, so it will be the osteoarthritis, knee degenerative disease, or the rheumatoid arthritis. When for the rheumatoid arthritis, what is the problem? When the treatment is for the autoimmune disease, so the steroids and the immunosuppressants, when they are taking steroids or immunosuppressants, it is aggravate the sugar control. The sugar will shoot up, and again you are increasing the insulin level or insulin injection or the diabetic medicine. So it is very difficult to treat this rheumatoid arthritis and this diabetes together with the medications actually. So what is actually lifestyle disease? If you are willing for the lifestyle disease, you can come out of the medication for both. Even from all the metabolic disorders, you can come out. We can come out of the medication for the metabolic disorders like hypertension, dyslipidemia within a month itself. For the arthritis, especially the rheumatoid arthritis patient, if they are on this methotrexate, MMF and steroids and all, many of the medications can be stopped within a month itself. Some depends on the patient also and the extent of the disease also. But within 3 months, definitely they can come out of every medications. That is what, if the patient, everything is if the patient is following the things correctly.
In this section, we dealt with the comorbidities, complications, and general role of lifestyle correction in the management with respect to insulin and diabetes. The next section, we will be looking at what are the possibilities with clinically supervised lifestyle correction for diabetes and insulin. Thank you.